Meet John. John has HIV, a disease that attacks his immune cells and progressively weakens his immune system. Lucky for John, he has been on drugs known as antiretrovirals since his diagnosis, and he has been able to live a fairly normal life. Unfortunately, a few months ago, John started experiencing some worrying symptoms, such as shortness of breath, a racing heart, and constant fatigue. Concerned that these symptoms were developing as a consequence of his HIV, John decided to go to the doctor. The doctor performed various tests to determine whether his condition is worsening. The tests that were performed were CD4 count, viral load, and other tests common for monitoring HIV status. CD4 count, viral load. You're probably wondering what all of this means. CD4 cells are the cells of the immune system that HIV attacks and eventually destroys as the virus replicates and spreads. A relatively high CD4 count indicates that John's treatment is managing to keep viral replication to a minimum. The viral load test measures the number of viral particles in John's blood. A low viral load indicates that his HIV is being kept under control as the virus's replication has been limited. Confused by John's results, his doctor ran further tests and found that John has high levels of fat circulating in his blood as well as high blood pressure. But wait, that doesn't sound like HIV, does it? In fact, John's symptoms point more clearly towards heart disease. John's test results show concerning risk factors for a collection of conditions known as cardiovascular disease.
This refers to conditions caused by the narrowing or blockage of blood vessels that can lead to heart attack, stroke, and other heart conditions. Cardiovascular disease has been shown to be associated with risk factors such as high triglyceride levels, high blood pressure, and inflammation. But what does this have to do with HIV? Research shows that living with HIV substantially increases your risk of developing heart disease, regardless of age, viral load, or CD4 count. In fact, living with HIV doubles a person's risk of developing cardiovascular disease. Let's take a closer look at John and see if we can figure out how this all developed.
When John contracted HIV, his immune system became compromised. The HIV virus targets the immune system, thus leading to immune deficiency over time. The immune system begins to fail, resulting in the increased risk of infection.